All right, so I have a new statistical breakdown of a model that was provided by the AP, where they are basically giving us a picture of how COVID is going to continue to surge into the winter, and exactly what we can expect from this latest surge, which is really only rivaled by the one that was during the last winter, where we saw deaths reaching upwards of like over 3,000 per day. So it was a completely ridiculous situation. And yet, even 2 years into the pandemic, as we should have been learning a lot of the lessons as to how we can actually handle this, it seems like we still have not learned a lot of those lessons, and there's a pretty dark future ahead of us. So 100,000 more COVID deaths seen unless the US changes its ways. So this is what their models are projecting. So the US is projected to see nearly 100,000 more COVID-19 deaths between now and December 1st, according to the nation's most closely watched forecasting model. But health experts say that that toll could be cut in half if nearly everyone wore a mask in public spaces. In other words, what the coronavirus has in store for us this fall depends on human behavior. And they say, quote, "Behavior is really going to determine if, when, and how sustainably the current wave subsides," said Lauren Ansel Myers, director of the University of Texas COVID-19 Modeling Consortium. And she says, quote, "We cannot stop Delta in its tracks, but we can change our behavior overnight. That means doubling down again on masks, limiting social gatherings, staying home when sick, and getting vaccinated. Those things are within our control," is what she said. And so this is the things that they talk about, right? They talk about the masks, obviously still important. They talk about getting vaccinated, obviously still important, social distance, the basics that we've known for the entire duration of the pandemic that still many people don't seem to be on board with. But the thing that they don't ever mention in these anymore is what a bunch of other nations around the world have done successfully every time that there has been a COVID spike. Why are we not talking about doing another lockdown? Remind me again, why are we not talking about sending people another, round of monthly stimulus checks so that they can afford to stay home, so that they are not falling behind on rent, and so that they don't need to go needlessly die for the stock market? These are the types of things that we could be talking about right now, but it seems like have just completely dissipated from the conversation surrounding how we are going to tackle COVID right now with this current surge. It's like, why could we not just have everybody outside of essential workers stay home for a month or two, pay them to stay home, give essential workers a massive, massive bonus if they are the people who have to go in, make sure that they have safe working conditions, guarantee that. And why are we not talking about doing that? It seems like nobody seems to have that even as a potential option in their mind anymore. But again, if things seem to stay the same in terms of how many Americans are wearing masks, how many are getting vaccinated right now, if we stick on track, 100,000 more deaths. I mean, this is at a time where we're 600,000 deaths already into this, and they continue saying deaths are running at over 1,100 a day on average, turning the clock back to mid-March. One influential model from the University of Washington projects an additional 98,000 Americans will die by the start of December for an overall death toll of nearly 730,000. Nearly 750,000 people have died so far, and that's just what's been counted so far throughout the duration of this pandemic. I mean, 730,000, really? Is that where we're at right now? This is what's deemed acceptable in the United States. Other countries around the world, even countries that are multiple times larger than ours, like China, have not seen this amount of deaths, okay? I mean, and you can, say whether or not you trust China's output of what they have been giving in terms of how many people have died in that country, but, it hasn't been 750,000, period. I mean, even if you think that they're undercounting the deaths, it has not been this bad, and that is because of the mindset that our government has chosen to take under the Trump administration and under the Biden administration, which is that, we can take some precautions. With Biden, it's been substantially better in terms of trying to get people to go get vaccinated and advocating for things like masks instead of railing against them. There have been marginal improvements, but I mean, listen, the differences between Biden and Trump in terms of how these waves are coming and rolling has not been that substantial, right? And that's because both of them, while there are substantial differences between them, both of them prioritize the economy. They prioritize short-term economic gains for some of the richest people in the country over public health, right? This is a public health crisis. It needs to be addressed in a public way. There is no individuality within this entire situation. There are a lot of people who are still harping down on mask mandates, and they're harping down on even the potential of future vaccine mandates, which I am still somewhat on the fence about, as if it's a freedom issue, though. This is not necessarily a freedom issue, okay? It's a public health crisis. Every single country around the entire world that has actually adequately addressed the pandemic has done so in a collective way. There is no, freedom approach, or I have the freedom to not get vaccinated and not wear a mask and then go out into public spaces. No, that's not your freedom, in the same way that it's not my freedom to go around, punching people in the face. Your freedom only extends to the limit of how you are impacting other people, right? And so that's what I understand this current situation to be. And again, I've been on the fence on whether or not we should be having vaccine mandates. Obviously, it would entirely depend on how vaccine mandates would be implemented. Are we going to take something of the French approach where you have cops who are roaming around in the streets and, literally beating the shit out of people? Or are we going to take a different approach where, you just say, if you want to go to large public gatherings, concerts, etc., then you have to prove that you have been vaccinated? And so there are different ways you can go about doing a vaccine mandates, but these are the types of things that we have to do if we don't want 100,000 people to die within the next couple of months. Now, is something going to be done about this? Probably not. Okay, we've seen schools reopening as children continue to flood into ICU beds, and it seems like it doesn't really stop anything. Okay, it seems like we are just rolling straight past this in the same way that we roll straight past, school shootings and stuff. When you have a situation where somebody can walk into a school and massacre dozens of children, and then we don't have a serious conversation about gun control or anything like that, or we don't implement any policy changes to actually change the situation, then you know that you live in a country that is not seriously trying to address the problem. And in the same way, with COVID, when you have 100,000 people that we know right now there are ways to mitigate those deaths, and nothing is seemingly being done about it, then the question is just, does our country even give a shit about these people dying? Are they just a necessary cost to keep the economy functioning in the way that our capitalist overlords want it to keep functioning? I mean, it seems like that is the situation that we actually have right now, but they continue just giving a little bit more detail here. The projection says that the deaths will rise to nearly 1,400 a day by mid-September and then decline slowly. And quote, "We can save 50,000 lives by simply wearing masks. That's how important behaviors are," said Ali Mokdad, a professor of health and metric sciences at University of Washington in Seattle, who was involved in the making of these projections. So 50,000 lives just by wearing masks. And, we can talk about wearing masks, we can talk about getting vaccinated, but the other statistic that comes into mind as we talk about this is Medicare for All, and how we saw studies at the beginning of the pandemic, or closer to the beginning of the pandemic, saying that like a third of COVID deaths could have been prevented if we had a single payer Medicare for All system, where cost was not a barrier to getting access to healthcare, right? There's a reason why many people are still vaccine hesitant, and it's because a lot of them, while some of them are really, yes, just delusional and out of their minds, many other people are just hesitant because of the history of our healthcare system here in the United States with African American people. They have somewhat a justification to be skeptical of big pharma, given the history of experiments on African American people here in the United States. Granted, obviously, I don't think that that's what's happening right now, but you have to look at the history of this to understand why people are so hesitant to trust the government, why people are so hesitant to trust big pharma. And there is a healthy skepticism that should be applied to big pharma, but that skepticism should be applied in the right places. And the right places to apply skepticism for big pharma are not on that the vaccines don't work, or not that is some secret plot to try to track you or whatever the fuck. The actual conspiracy surrounding the vaccines is that you have a handful of gigantic big pharmaceutical companies that have profited already billions, if not tens of billions of dollars off of these vaccines, and they are currently price gouging not only the American people who helped to fund the creation of these vaccines through our tax dollars, but they're also price gouging the rest of the world, and that this is at the expense of the rest of the world getting vaccinated, and is therefore to the benefit of COVID as it continues to spread all around the world and creates new variants that will inevitably come back here to the United States and be a threat to us and be a threat to the vaccines themselves as new variants emerge and undercut a lot of the ability for the vaccines to prevent infection and prevent hospitalizations, etc. And so the actual skepticism that should be applied to big pharma should be on that front. It should be understanding the profit motive within the pharmaceutical industry and understand the solutions here remain the same, okay? Like I just said, 1/3 of potential COVID deaths could have been prevented with a Medicare for All system. In the same way, we need to be nationalizing our big pharma industry in the long term so that people do trust big pharma, not in the sense that it's big pharma in the private sector, but big pharma in the sense that the government is funding innovative research to then be for the benefit of public health of American citizens and to the public health of the world, and not just to the benefit of a handful of shareholders and executives and CEOs who sit on the boards of these big pharma companies collecting billions and billions in profits, okay? So that's the healthy skepticism where it needs to be applied. Those are the actual solutions. You nationalize the healthcare system, you nationalize big pharma, but in an immediate sense, right, we could be doing another lockdown right now. We could be doing a month-long, 2-month-long lockdown where we're trying to mitigate some of these deaths, but again, it seems as if the trajectory that we are on right now, nobody seems to give a shit about the fact that 100,000 or more Americans could be dead by the beginning of September or December.